Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
We're very excited that this is our 14th annual gun buyback here in Worcester, which we call the Goods for Guns Gun Buyback Coalition. We started it in 2002, and it's been going on for all those years since then. Each year we've tried to do it around Christmas time because it seems to be a time when people are really thinking and taking stock of the need for peace on earth and things like that. So no matter what your religious or ethnic background is, there's always a time in the winter solstice that people take pause and say, you know, I'd like to have a better next year. And one of the things you can do to have a better next year is to take unsecured weapons out of your home and bring them in so we can destroy them and keep them from being a public health problem. We've set up the Worcester Police Headquarters as our main retrieval center. District Attorney Early has given amnesty to anyone that has a weapon that they want to return, so that even if they don't have the right carry permits, they can bring the weapon in a brown paper bag or a plastic bag, keep it on the front seat of their car, drive into the police station. There they're greeted by armamentarians who are specialists in weaponry from the Worcester Police Department, and they make an assessment as to whether the guns are operable, make sure that they're not loaded when they come in. And then we reimburse them with a group of volunteers from really all over the Worcester County area, but a lot of our medical school staff participating. $25 for a long rifle, $50 for a handgun, and $75 for a semi-automatic, either long or short weapon. To local grocery stores. We basically want to give people a little holiday cheer maybe, and they can make themselves a nice meal or augment their shopping. It's completely anonymous, but there is the opportunity of helping us try to figure out the demographics of why people came in and who they are by doing an anonymous survey. We also give out at that survey station trigger locks for people that have weapons remaining in the home that they want to secure, or if they have loved ones that they know have weapons, they can give this as a Christmas gift. From the very beginning, it's been a really great public-private partnership. We've had UMass Memorial Medical Center give us generous donations each year. The medical school, various facets of it, has helped us. I run an injury prevention program that's been partly grant funded, and we also been able to contribute. We've also gotten money in the last few years from DA Early, from some of his drug take-back money, the money that's retrieved during drug arrests. We've also gotten money from the City of Worcester, gotten money most recently from Fallon Community Health Plan the last 2 years, which I think is really a tribute to the fact that we have shown over the 13 years previous to this that the total cost of running the program for 13 years and retrieving over 2,500 weapons has been less than the medical costs that would have been generated if even 4 of those weapons had caused an injury. So in the truest sense of the word, it's kind of managing care because we're preventing medical costs. We have a number of options for people in central Massachusetts. Leicester, that's one of our main pickup points. We're also having pickup points in Grafton, and there's a list now of other towns, Sturbridge, Oxford, that are also going to be doing it. We have been tracking since the beginning of the program penetrating trauma rates in central Massachusetts versus the other 6 counties in Massachusetts. And it's always been somewhat of a puzzle that really since 2006 and 7, whereas other counties and other cities have had an increase in firearm injury, Worcester has had a diminution of those numbers. Chief Jem and Chief McGinn, who work with us from the Worcester Police Department, feel very strongly that it is part of an overarching program that looks at how do we issue gun permits, how do we punish gun brandishers in crimes, how do we investigate shots fired in the city. all of those things collaboratively lead to a lower incidence of gun violence. Consistently, Worcester per capita has the lowest penetrating trauma rate of any city in the Commonwealth. We estimate that 1/3 of the homes in Massachusetts have weapons. If even 20% of those are not secured, that's easy pickings for a burglar. And a lot of the gangs do have an initiation process where a young person who wants to join a gang will be told, well, come back when you have a gun. It's not like they're going down the south to get their guns out of somebody's trunk or a gun show. They're probably just burglarizing a home. Right now, a weapon in the home is probably just as attractive as a laptop used to be, or jewelry, or stuff for easy pickings. And I think, unfortunately, with the opioid epidemic too, because weapons have a certain amount of fencing ability on the black market, it's a very attractive thing to try to burglarize. There have been 2,563 weapons in the previous 13 years. We've always done it around Christmas time. Unfortunately, this is the 3rd anniversary of the Newtown tragedy. We've now tried to time the gun buyback to synchronize with that. We've been working with an organization called Moms Demand Action, which is one of the offshoots of the Everytown movement that came out of Sandy Hook tragedy. And those moms are very much into trying to educate the public about the need to ask where your kids are playing. Is there a gun that possibly is not secured? So the partnerships that we've developed have clearly been with an agenda that we have to learn to live with guns. There are 350 million guns, it is estimated, in the United States. That's just about 0.9 for every person. So almost 1-to-1, right? We're never going to get rid of all these guns. Nobody's going to come and confiscate all these guns. We're in favor of the Second Amendment. All of the police chiefs would tell you that they're proud gun owners, and their staff are as well. But with that gun ownership right comes the responsibility to store these weapons safely, away from kids, making sure that they're not in an area where a despondent adult or teen can get to them, because 65% of the gun fatalities in this country are suicides. And when you use a gun as the mode of suicide, you're successful 95% of the time. So this is a huge piece of low-hanging fruit. And that's why I think it's been wonderful to have Mayor Petty, the city manager at Augustus, embrace this as part of the community health improvement plan. We can really reduce preventable medical costs by trying to eliminate this as a source of injury.